You've mentioned to me before that the real challenges around preparedness. You just touched on that being a huge challenge. Say a little bit more about, if you would, that challenge. What was challenging about it, perhaps, and how you really dealt with it, which you've already touched on, Leah. That was a big challenge for you because you came in at a particular point in time. Tell us a little bit about that important challenge for you.
So I did start as the state health director in May of 2001. So the towers came down in September, and then the anthrax index case, the first man that was sick and died with anthrax, actually was from Florida, but he got sick in North Carolina. So we, along with Florida, were the epicenter for that very first investigation of an act of bioterrorism. And so right out of the box, we were going through hospital records and looking for where the exposure might have been and whether anyone else was exposed. So it was a time of high risk, high concern, and we right away knew we had to ramp up not just the investigation, but communications with the public and making sure that we were communicating in a timely, complete, and accurate way. Every day, every morning, every afternoon, there would be a media, either a press release, a media availability, a press conference where we had all of our partners together. But that public face of we've got this, because actually it was a really great opportunity for us to illuminate actually who we are in public health, what our role is, that for 100 years we've been investigating infectious diseases and detecting early and responding rapidly so that we can contain the damage done when there is an infectious disease in the community or foodborne outbreak, for example. So we were able to demonstrate that there's a local health department in every county in our state. This is what they do. This is what we do. Now, this has got a twist because it was intentionally delivered, and that's frightening and brings new partners for us to work with. But that we have the experts in the science, in the medicine, in the epidemiology. We know the community. This is what we do. And that was a really strong and powerful message for the community that really thought the health department was that clinic on the corner down the street. And we were able to say, no, that's important. Some of us do that. Some of us don't. We do it in North Carolina. But our community health protection role is foundational, and we were able to demonstrate that.
Wow. It really opened people's eyes to a whole different aspect of things.
Yes, it did.
Remind us what years you were in service as a state health officer. When were you a state health officer?
I was first appointed in 1990, and I left in 2003.
And during that time, let's just talk about, you had so many challenges. Just name one issue that was among the most challenging, most exciting that you had to confront, and talk about leadership lessons you learned in confronting it. Would you just give us a specific of your experience as a SHO?
My guess would be is that every state health official who was a state health official in 2001 would say that the events that happened on September 11th and actually subsequently in October with anthrax was a wake-up moment. And for me, it really was a culmination of work that we had begun in the agency many years prior to that. And it was a sort of a validation of an approach. It was our major challenge. It's hard to describe the environment when those first anthrax cases were reported, where we were getting calls from daycare centers. They were talking about, we've discovered a white powder by the changing table. Well, was anybody using baby powder? Someone got a letter full of white powder, and we said, where did it come from? Well, it came from my daughter. Did you ask her if she sent it? Oh. And when we went back, yes, she actually thought I didn't have any baking powder, so she sent the recipe with the baking powder in the envelope. There was a mass hysteria around this. But part of what our response was building upon the partnerships that we had built. partnerships with the state police who worked very closely with us around all the reports of white powder so that our laboratories were not overwhelmed. The ability of our laboratories to do the kinds of molecular biology to test whether or not these samples actually might have anthrax. All of that was based upon prior work. And the ability to work with our emergency management agency. And that all was put in place, our ability to respond to this challenge, by some of the work that we had done prior. For example, about 3 years before that, we had an activation of our State Emergency Operations Center. It was about 11 o'clock at night. And we're sitting in the center because there was a report of a laboratory that was found in one of the western suburbs of Chicago. And in that laboratory, it appeared to be a bio-level 4 laboratory. And we were sitting there with the director of the Emergency Operations Center. We had one of our employees who was trained because he had come in from a police background, a military background, and how to use biohazard suits. And they were entering the laboratory to try to determine what exactly was going on here. We had the FBI on the launch pad at Quantico, ready to come in and help out if we could in fact determine that this was a risk. And as we were just getting the description from our staff who was in there with signs on the wall that said, "Go, bugs, grow," all of a sudden something clicked in my mind. And there had been an earlier investigation about fraud. And it turns out that this actually had been a case that the Attorney General was investigating because they had a simulated bio-level 4 lab. And that they were bringing in potential investors in this new innovation. And when I brought those together and brought it to the Emergency Management Agency at 1 o'clock in the morning, and the head of the state police at 1 o'clock in the morning, they began to realize, in fact, the head of the Emergency Management Agency said that every disaster has a public health component. So when we got to September 11th, and we began to respond, and I was sitting in the Emergency Operations Center, we knew each other's names. You never want to get into a disaster situation and exchange business cards. You want to work with people you've worked with and thought things through. The second thing that we had done to prepare for that was recognize the importance of bioterrorism as a public health challenge. Much as current public health officials and state health officials in 2017 have identified ahead of time the challenge of the opioid epidemic, and to make plans in place, and to recognize that you can't always get funded when you think you have a need, but if you explore it and put plans in place, when there's an opportunity, you can actually get funding. So we had wanted to expand our laboratory to include molecular biology. And we put it in our budget, and the Bureau of the Budget said no, and the governor's office said no, and we put it in the budget the next year and the same answers. And then there was an outbreak of invasive group A strep, also called flesh-eating bacteria. And it was in a small town in central Illinois. And at that point, there was a lot of news and everything. And the governor's office said, and the Bureau of the Budget said, well, what's going to be our response? And my response was, we need to expand our laboratory. $500,000 immediately became available, and we built in that molecular biology capacity. If I hadn't been ready for that answer, and I could say, this is exactly how we spend it, it would have been a missed opportunity. And we would not have been available in 2001 to have that laboratory enable us to respond to the thousands of white powder evaluations we had to do. So it's identifying where the challenges are, looking at opportunities, and then taking that opportunity when it presents itself to move forward the public health agenda.
give me just one most important challenge you faced in your time as state health officer, and then talk about leadership, lessons learned and leadership you had to exert.
Challenges come in many different shapes and forms. One of those challenges is a very large print headline in the very important newspaper of the biggest town, talking about the Department of Health as licensed to harm. I happen to have the responsibility to license all the state health officials, and there were some things that we didn't do well. That's a very humbling pill to swallow. And to make sure that you've prepared the governor for that kind of headline was going to come, and hope that the governor would stick with you to go through the improvements that were needed. So that kind of challenge of managing the media, making sure the staff didn't lose their confidence in what we were doing, and then leading through the improvements that needed to go on was a huge, huge challenge. Another one of the kinds of challenges is certainly everything that we faced after September 11th, 2001. We were not prepared as a system, and we will be better prepared every day that we work on it. But the coming together of state health officials across this nation and learning from our colleagues in the eastern states and Washington, D.C., even though Seattle and Washington State were far away, we needed to be ready for things that we couldn't anticipate. Whether it was the H1N1 flu epidemic, we used the skills that we learned in preparedness. Whether it was when Fukushima blew up in Japan, and while it didn't impact the United States, the amount of fear that people had about radiation impacting them, used every skill of risk communication, giving the public the kind of information they needed so that they would feel comfortable in trusting you that their health was okay. Those are challenges that are not easily defined, and you've got to have skill building and leadership building prior to that to get through those challenges.
You were a state health officer in Indiana during a time when there were a lot of challenges in public health. Do you want to name one of your favorite challenges and talk about it a little bit?
Well, so I would tell you on the national scale as well as state and local was H1N1. So I was president of ASTO, and I was state health officer during the H1N1 pandemic. And so I found myself in a leadership role on multiple levels. And we had a lot of challenges during H1N1. The vaccine was supposed to be available at a certain time. Everyone had been assured, and then it was delayed. Messaging that was a major challenge. Getting folks to comply in the early days before we had a vaccine. How do you get your public to begin to wash their hands and stay home when they're sick and, use their sleeve to cough into? And so communications, again, is just one of the things that was really needed to be able to overcome those challenges. Convincing the governor to stockpile, to mobilize resources. At that time, we were talking about antivirals, and you have a strategic national stockpile on the national level, but there was opportunity for states to stockpile further for their amounts for their population. And I can remember having that conversation with the governor about mobilizing resources, and in my case, a conservative state, but that happened because at that time, that's what we felt like was one of the better things to do. School closings, oh my, that was a real challenge because there was, quite frankly, there was some delay in getting the guidance out from CDC, and you had all the school superintendents. I can remember there being some pretty tense moments, especially when in some jurisdictions there were reports of either teachers or students that were quite ill or deaths that were occurring during H1N1. So there were challenges on multiple levels, and coordinating between the local communities, the state, and the federal is obviously something that needs to happen, but it happens many times behind closed doors. I can remember one time with the school closings, I had to make sure that the local health officer and the local school superintendent was aligned with the state and the governor and so forth, and we had multiple phone calls for hours the evening before, the morning before, to gain consensus. But when we all stood up shoulder to shoulder at the press conference about 2:00 in the afternoon the next day, we were all aligned, and we got so much praise from the public because everyone saw that we were all on the same page and giving the same message.